I think we're going to be rounding everybody up, and it's almost time to get started for our next presentation. It's just really great to get to talk to everybody. So I think that's why we have a lot of people outside getting to talk to our amazing support organizations and other people they're getting to meet. So hopefully I will introduce Crystal Ward. She is going to be speaking about finding your new normal. Crystal Ward is a Robert H. Lurie Comprehensive Cancer Center's Women's Cancer Social Worker. Before taking on this role, Crystal was a program manager and oncology social worker at the American Brain Tumor Association. She attended Northern Illinois University and received her master's degree in social work from Loyola University here in Chicago. And she specialized in health and her clinical concentration was on children and families. So welcome, Crystal.
All right. Hi, everyone. So, hi. The room's coming in. Feel free, have a seat. We're all humans, so if you have to get up, go to the bathroom, get more food, I won't be offended at all. I kind of feel like with my topic today that I should actually be at the end of our day to kind of tie everything that you're hearing with a nice bow, because I know Raquel Gonzalez is also going to be talking about exercise after me, and I'm talking a little bit about that too in my presentation. So hopefully you can kind of keep that in mind too while we're going through. A lot of what I'm talking about is what Judy and Mary already shared with you, so it's just going to be validating for them, for what you've already heard. And I think so. The agenda for today is where I'm going to talk a little bit about the impact of the diagnosis, and I'm going to do this more from family therapy and social work side, so it's a little different perspective. The emotional and physical reactions that are pretty common, some coping strategies for you all, and ideas from other patients and caregivers that I've heard along the way from my experiences having conversations with actually many of you in this room, and then also my work with brain tumor patients at the ABTA. Hopefully we have some time for a values activity and we can get a little bit of engagement there. And then some takeaways, or as Miriam likes to say, tools you can use when you leave here today. So I do want to talk a little bit about the diagnosis. I know that you already heard from Judy the history of cancer, and you kind of have that frame of mind set in stone. But from a family therapy perspective, and the way that I kind of view my work with individuals and families, there's three things that I really try to keep in mind of how an individual and family is adjusting to the diagnosis. And certainly it's onset, the course of the illness, and then the outcome. And a lot of these things are kind of talked about in your initial appointments with the doctors and when you're given the diagnosis. So the onset, whether this was acute or gradual, was this something that kind of blindsided you and the family? Or is it something that you felt the symptoms and you kind of weren't feeling well and you've been making adjustments throughout your day already? And then the course, when you were given the diagnosis, is it something that you were told that it could get worse over time? This is kind of the course of what that cancer typically looks like. Is it constant? Is it, that chronic disease that you're going to be coping with? Or is it something relapsing? So where you have the diagnosis, you go through a line of chemo, come out, have some remission, and then, years down the line, another recurrence and going through that same cycle again. All of these things try to keep in mind of how an individual and family is coping. And then certainly the outcome. And a lot of folks don't like talking about this. It's not something they want to discuss. But it's important to keep in mind because just like Judy mentioned in hers, when you hear that word cancer, sometimes we automatically go to it's terminal or fatal. But that isn't necessarily true in all cases. So sometimes, it's not terminal, it's not fatal, it's that chronic condition. Sometimes it is shortened lifespan. And then unfortunately, we do have patients who come to us where it is terminal. It's weeks to months to live because of, just the progression of that particular cancer. So all of these things, it's a tough topic for finding your new normal for me to talk about this without addressing and acknowledging that all of you in the room are going to be coming at the diagnosis from different places. So survivorship, as we've already heard today, a lot of cancer patients, it is something that they can survive more than 5 years. And even, the 1 million survivors have lived, decades long with this diagnosis. So when we're talking about finding your new normal, that can be, months, years, decades long of adjusting to this diagnosis. And common reactions I hear, this is, from people with cancer, but then also from their families, just frustrated with the diagnosis. I want things to go back to normal. I miss the way things used to be. And before I had cancer, I, fill in the blank of whatever those things come. And I want to talk a little bit today about why does it feel so different now that you have the diagnosis? Why does life feel different? And sometimes we can't really pinpoint it, but I just want to talk about some common things that we don't always think about why life is different now. So you have the everyday changes. You have a whole new routine. The appointments, whether they're routine or follow-up, scans and tests, and then certainly the treatment. If you have surgery and some recovery time, chemo and radiation, and then the taking of medications. Lainey had her picture up there of all of the medications she takes, and I just spoke with a patient just a week ago, just really struggling. It took me so much just to take a multivitamin. And now I have an entire counter full of meds that I have to take. And it's like every morning I wake up and I have to, face the diagnosis because of, what's on my counter. So a lot of those daily changes. And then family and social changes. So changing roles and responsibilities. Coming from that family perspective, it's really, sometimes we have family members that come in and they want to help and they want to change their routine even without you asking. And that can really put a change in your routine of what your life used to be. Certainly if your husband always did the bills and now is having some chemo, brain and isn't able to do the bills and you have to step in and help him. We also have a lot of, I work with women in the Women's Cancer Center, and I'm often working with women who did the majority of the child care in their family. And now those responsibilities are going to grandparents or aunts and uncles and kind of stepping in, and what does that shift look like in their family? Traditions and holidays, Thanksgiving was an all-day cooking affair at grandma's house, and now we just really can't do that. So, is it a short morning brunch at another relative's home, or is it actually going to a restaurant and having someone else cook for you? That really shifts up, what those family traditions look like, and something that, families go through year after year, and that change can be hard. It can be really great for the person cooking sometimes. But it can be hard for the family to adjust. And then friendships. So I previously did come into Northwestern and work with brain tumor patients, and I would go across the country and we had these patient panels, and I just was so touched with, we had one topic was always about changing friendships and how that looks. And with a brain tumor diagnosis, sometimes it was so scary for friends and family that were so close to those friends to really cope with that they just stayed away. They couldn't even be around the patient anymore, and so the family grieved that relationship they had with those friends. But then they gained this sense of new friendships of other people and other caregivers and people who have brain tumors like themselves that they could connect with and empathize with each other, and those friendships actually became really strong and very, very meaningful to them. So, all of those different changes in life. And then identity. So this is different for everyone, and I really, there's a lot of advice out there about, how to view having this diagnosis within our culture, within media, social media, all of these things kind of, put into play about how people are supposed to cope with cancer. And, Lainey even shared she really embraces the survivor and the fighter identity. And I really, for some patients, it's really meaningful for them to just own that and identify like that. But for others that I work with, they say, you know what, I'm a person who had or has cancer, but that's not all of me. And that I don't want to be called a survivor. I don't want people to necessarily know. I want them to not even, acknowledge that piece of me. It's an experience I had, and it's not something I want to really incorporate into my identity. And that's a personal, response. That's something that you thinking about for yourself. How much do you want to incorporate this diagnosis into your identity? Unfortunately, I do have some patients just culturally too. Different cultures view cancer differently, and sometimes I've heard, I'm a victim to this cancer. I'm just a patient. The doctors know all, and so those things, when you hear yourself saying that, that's just you taking a piece of that identity or that diagnosis and kind of owning it in your identity, and just be mindful of how it's having an impact on you. So practical issues that change your everyday. As a social worker, I work with a lot of families and individuals around these issues, and disclosure at work is really a big topic. Do I tell my boss, and are they going to treat me differently, or did you tell your boss or colleagues, and some of them treat you really well, but you can tell that one person, I think they're not being completely true with me, and treating me a little bit different, and is it because of I shared with them that I have this diagnosis? Extended leave and taking FMLA, just if your work provides you a lot of meaning and it's more of your career, and that's something that you really embrace as your identity, and then taking that leave can be really impactful of, it changes, and when you come back, what does that look like? And then changing responsibilities when you do come back. I worked with a benign brain tumor patient, and he unfortunately had some cognitive issues and some memory issues, and was not able to be in a supervisory role anymore at work. But with reasonable accommodations, they were able to make adjustments and keep his employment, so he was going to work every day, but it looked different, and he was no longer the supervisor, and that was infuriating to him. It was frustrating that people weren't taking him seriously, and they knew about his diagnosis, and certainly a benign brain tumor too. That's was difficult for them to understand because they couldn't see it. It wasn't something visibly they could tell why he wasn't a supervisor anymore. And then finances. It's insurance issues. If I could change one thing about all of this, it would be insurance, because even the most educated person finds working with insurance companies and all of these claims difficult, and it can become draining and overwhelming, and impact your just ability to cope every day. And then the cost of treatment, and if there's loss or decrease in income, so that can be pretty detrimental for our lower income folks, but even for those in the middle class or upper class, the cost of treatment completely shifts their lifestyle, the activities that they can participate in. It really shifts what you're able to afford and not afford when you have to pay for all of those pretty high bills. And then cancer-related fatigue. So we know that this experience, the diagnosis can bring, you've heard it today, nausea, trouble pooping, pain, and one of the most significant things that even long-term survivors struggle with is this cancer-related fatigue. And it really is this persistent, subjective sense of tiredness. So no matter how many naps you take, no matter what you do, it's just on you, and it just wears you down, and you can't get up. And it's the most infuriating, I hear, for caregivers, for those husbands and children. And why can't you've been through treatment, you've done this, why can't you just out and do this activity, or why can't you come to lunch with us, or there's a lot of frustration around this fatigue, and understanding it within the family of how that's really impacting the patient. And so we do know there's been lots of studies about this, and Dr. Pierman here at the Cancer Center has actually been involved. 60 to 90% of patients experience cancer-related fatigue. It is associated with the disease and can also be with comorbid conditions. So it can increase as the disease advances. And it is also related to anemia, depression, pain, and insomnia. All of those things can just exacerbate this fatigue. It's also caused by treatment. So if you're going through radiation, that's really high statistics. If anyone's in stats, those are huge. 60 to 93%, 80 to 96% with chemotherapy. And then, of course, after surgery. And there's been a couple studies about surgery that even 5 years after having major surgery, no matter what it is, fatigue can be one of the side effects. So typical emotions, you've had some slides already from Judy, and this is just, from a social work standpoint of, I meet with a lot of patients who go through just pure exhaustion, navigating all of these issues I've already had on the previous slides. Isolation, because gosh, no one can get what I'm going through. They aren't living this day of calling insurance companies and going to appointments and taking medications, and it can be quite isolating. Just feeling fear overwhelmed with, the what ifs and, all of those different situations you're going through. The altered body image, if you're losing your hair. I work with women who've had mastectomies and, certainly weight gain, weight loss, and the way you look can be different. And then for those survivors, or even if you get the clearance of everything looks good, it's still that fear of recurrence. General anxiety, anger and frustration. And mind you, some of these are, I'm speaking to caregivers too, that anger and frustration can be pretty overwhelming for caregivers too. Pure disappointment, just being disappointed at not being able to go with your friends on those shopping trips, or not being able to participate in family traditions the way that they used to be done. And then I want to talk a little bit about grief. Judy talked about grief in a couple contexts, but I really wanted to talk about grief and the way acknowledging the losses along the way. So, the loss in the identity, whether losing your career, losing those relationships with the friends and family members, and the grief with the traditions too. So this is really important to keep in mind. The shock and denial, anger, depression, but also detachment from enjoyable activities. This kind of internal dialogue and bargaining. Gosh, if I would have ate more vegetables and didn't smoke, or did this, what would have happened? Would I be going through this? And then acceptance. And I want to say all of this is not in order. So you can experience all of these feelings within one day, within one moment. You can go back and forth. I mean, it's really just keep in mind, and it's about being human and acknowledging that what makes us human is being able to experience all of these emotions. Do you want to take a moment to talk about depression? Because one of our roles here as social workers, and we have psychologists on staff, and even Judy and her work and your team, is really identifying if a patient, we know that the feelings that I've shared in previous slides are common and normal, but what looks abnormal? What are we kind of triggered on and, looking for to really identify additional help being needed? And this is when there is, this major depressive disorder. So if you are having any of those feelings for more than 2 weeks, and quite honestly, if you're having them for a week, where you're not being able to get out of bed, where you're saying no to all of your friends and family and going on activities, maybe you enjoyed taking walks and now you can't, even get out of the house. We want to know about that because it's really important for us to really identify when there is major depression going on. And oftentimes it's not the patient telling us that they're experiencing this, it's the caregivers. Like, we're really struggling, mom just won't do anything, and this is what we're seeing. So caregivers, these are some of the things to be on the lookout for. I want to talk about, when those symptoms happen. It's not always just general coping with this. There's a lot of contributing factors that it's really important to talk to your medical team about, because we know the medications that you're taking, there may be an infection going on. For women's cancer, there's a lot of hormonal changes going on and the impact of treatment on hormones, possibly blood counts, and then pre-existing and not treated depression and anxiety. Sometimes if this has been a long-term issue for you, and just cancer within a family, from the family perspective, anytime there's a major diagnosis within the family, anything that's been going on and was maybe, hate to use the word dysfunctional before, or struggling with before, cancer just elevates it, just kind of sifts it out and brings it to the surface and kind of sets it up. And then nutritional deficits, and certainly sleep disturbances, so your sleep environment, things like that. And I know Raquel is going to be talking a little bit about exercise, but this is one thing when you're adjusting to your new normal, finding your new normal. I want you to incorporate exercise. If you take away anything from today, please go home and have some, do some exercise. There's been lots of studies done about the impact on exercise on fatigue, cancer-related fatigue specifically, and then also depression in general. And people, as much as you come and see one of our psychologists, you meet with a social worker, you go to those support groups, we actually find, if all of our patients did exercise, we would be put out of business, because that has more impact on, those issues than any of those other supporting activities. And certainly yoga, a lot of patients find that very helpful, and it's 30 minutes of moderate activity for most days, so 2 to 3 days a week at least. And then seeking support, Lainey talked a little bit in her great presentation about the ways that she sought support, but it can be tough. And honestly, it was on Judy's not to say you're brave for asking for help, but as a social worker, I do think it's brave, because it puts you in a vulnerable position. It identifies issues that you are struggling with, and it's vocalizing it. And so, sometimes it's the first time that you're communicating, what you're actually going through and asking for support. So I know when I'm called to meet with families that's, a very important meeting, because this might be the first time that the family is acknowledging what's actually going on and under that surface, and that they do need help. And it's gotten to that point where they're going to ask for it. Again, talking to the medical team and ruling out any of those contributing factors. Identify friends and family who help. That's the key there. Who are supportive, who give you the support when you walk away from talking to them. You say, "Gosh, that was really great. That felt cathartic for me. I had a lot of fun with them. I'm gonna look to them again." And then supportive oncology services. Certainly, you can page to have any of your social workers. We can come and meet with you, whether you're in treatment or at an appointment. You can give us a call and schedule time with us before or after you're coming for one of your appointments. We have psychologists here who do more longer-term counseling. And then we also have great Gilda's Club activities, or you may have cancer support activities. Judy talked about it. There's booths out there. And then support groups. Robin and I think Robin may have left already, but we do a metastatic breast cancer support group. There's a couple other support groups on our website that you can check out that nurses and social workers run together to support you and your family. And then growth and resilience. I really want to talk about this. This is really important for you all to know. So I talked about all the changes, all these negative feelings that you can have, grief. But in all of this, there's been a lot of studies on patients or people who have cancer, and what kind of growth and resilience they've shown. And it's actually positive adjustment within 1 to 2 years, and positive life changes reported in majority of patients. And some of those benefits, it's greater compassion, enhanced intimacy, and knowing those relationship qualities. So I talk about those issues being kind of surfaced within a family, but once those issues come out and you're seeking support and you're talking to the right people, those can be some of the most impactful moments for families to really iron out and resolve some of the issues that have maybe been long-standing within a family. And that can provide a lot of meaning, and that can really be helpful near end of life when that time comes for any of the family members, knowing that they could resolve some of those moments. Enhanced skills and strengths. I meet with a lot of patients who are like, gosh, I never knew I could even do that. I just heard of a patient who went and climbed Mount Everest at 82. So, I'm not promoting that at all, but there's some things that, maybe without the diagnosis you wouldn't have even imagined you could do or that you wanted to do. And then certainly deepen spirituality. Anytime that, our life is kind of in our face, it really brings us to that greater sense of self, and that there is something bigger out there, whatever your faith or spiritual ideas are. And just want to say, growth and distress can and do coexist with each other. And here are some ideas from patients and caregivers that I've just wanted to put down to paper for you all. I have one particular patient who will not use the word exercise at all. She says it's movement, Crystal. That's all I need to do, is movement. Keeping a journal, and so 2 things. So yeah, we can keep a journal about your feelings and your experiences about this, but I also really encourage journaling for new patients, because then you can get a sense of, gosh, 2 days after chemo, I feel like crap, and it's consistently, every time, 2 days after chemo, that's my bad day. So I'm not going to schedule anything on that day. I'm going to let myself rest. I'm going to be near my bathroom, so I'm at the comforts of home. But on that 3rd and 4th day, I'm going to do something fun, and that's when I'm going to try to go have lunch with my girlfriend, or I'm going to, get out there with the family and do something fun. So journaling, both practical and emotional. Start a new hobby if there's something you've always wanted to do. Now is, a good time to pick it up. Support groups, becoming a volunteer. So we talk about these survivor events, and we have all these walks, and that can be really beneficial for folks to get connected to others. But there's also volunteering. I have a patient who goes to the animal shelter and just pets the cats, and she loves it. And so that's something new for her after diagnosis. Create positive rituals for chemo, scans, appointments. We have this great organization. I'm not sure if I saw them out there, called Culinary Care. Oh my gosh, I forget. But Culinary Care, when you're here for your appointments, you can actually schedule a meal from them, and they are the local restaurants around here donate meals to families here at the hospital for you to have. And I had someone who had a meal from Gibson's last week. So they're free, no cost for patients. I believe there's 5 or 7 meals you can get. So that's a positive ritual. If you're going to get a good meal when you're here, for maybe a follow-up scan that you're kind of nervous about, kind of incorporating those positive rituals. Use technology. I worked with a lot of brain tumor patients before coming here, and this was really beneficial, especially for the memory issues. But in general, it just makes life easier. We have My Chart now, so you can feel that you have that connection to your medical team when you're at home at 2 in the morning, having one of those ruminations about what's going on. You can email them and maybe feel better and go back to sleep. Keep connected with friends and family. So maybe it's not that all-day shopping trip where you went to 5 stores and then you went out to lunch. Maybe it's going to 1 store and seeing how you do. And then, if you have to come home, you come home, but, kind of adjusting that connection time. Practice or reconnect with your faith if that's important to you. Definitely spend time in nature. There's been a lot of studies done now for people in general. There's been a few here. True North Treks is doing it. It's a program here for young adults, but just the therapeutic and restorative And then I really encourage you to disconnect from cancer at least sometime. It can be really engulfing in your rituals and all of these things if you're just talking about it all the time. And I always say, what did you do, that wasn't related to cancer today? Especially for those ones that are involved with the survivorship activities. I had one couple, young couple, brain tumor. The husband had a brain tumor, and the wife said, you know what, we had tumor-free Tuesdays. We went to trivia night at a local bar. All of our friends knew, do not ask us about updates, do not ask us about what he's going through. This is a time for us to have a few beers and spend time with you all. It's tumor-free Tuesday. So that's great. I'm getting the look from me. So I'll try to wrap it up. Do we have time, Miriam, to do the values activity? Okay. So I don't know if it's already on your tables. Oh, it's in your bag. So if you can do me a favor, go in your bags. There should be a worksheet in there that talks about your values. And I think it's adjusting to your new normal. Finding your new normal is at the top of it. So what I want you to do is just pick one question on that worksheet. I'm going to give you 2 minutes here, and I want you to share your answer with the person next to you. And if it's someone that maybe you want to step out of the people that came with you, you can kind of mingle with some of the other people at your table too. So one question, and I want you to share the answer with the person next to you. I'm not hearing a lot of talking. So share with each other or talk about it with each other. Or if there's something you heard in the slide that is kind of on your mind that you'd want to talk to someone, you can. Okay, so some of you said that the worksheet is not in your bag. I'm hearing some folks. So pick a question up from on the screen. Okay. All right, I think, see some head nods, some people mingling. So the reason why I want you to take this worksheet home and encourage you to fill it out is, when you get into the rut of all of these changes that I already talked about, recentering yourself on what your life means to you, on your values, on finding meaning in your day can be very, very important and helpful in adjusting to the new normal. All right, everyone, we're going to wrap up. So I'm glad to see some of you got out of your comfort zone and were able to mingle with each other and share. I'm going to wrap up with my last slide here. So I just want to send you home. So the values activity is definitely one tool you can use, on those days where you're feeling really overwhelmed by what you're going through or having any of those feelings. It's good to kind of pull out that sheet, fill it out and keep it on hand to kind of remind yourself about what's meaningful to you in your life. From the presentation today, just some other takeaways and tools I want you to go home with is just, remember to keep your support system close by. I want you to prioritize your activities and tasks which give your life meaning and bring you joy. If it's not helpful to you, if you're finding it, not something you enjoy, try to find a way of, dissolving that. And then have self-compassion, or what I like to call grace for yourself, because this is a tough situation and you are going to have, just even if you didn't have the diagnosis, sometimes we just have really crappy, bad days. And it's good to have self-compassion on those days, that's what makes us human. If we didn't have that, we actually would be what's called in social work terms a sociopath, right? So it's good to have those feelings, to be a little bit raw. And keep what works, eliminate what doesn't. Keep communication open and honest with your friends and family, and especially with your medical team. And always be flexible. Instead of saying no to activities, is there a way that you can find a different activity, a different way of problem solving so that you can still participate with your friends and family and do life in the way that you want